I'm going to turn it over to our presenter, Deborah.
Thank you, Jim, and hello and welcome everyone. Thank you for joining. Really excited to jump into this topic today because I know it's something that is sort of starting to get into our field, and it's really important for us as SLPs to really be on the side of understanding how some of these technologies refer to us and can be used by us to just make things a lot easier and also better serve our clients. So before we get started, wanted to give you a quick background and introduction for myself. I am a speech language pathologist and I've had about 18 years combined experience in a variety of settings. And it's really given me the opportunity to just kind of get a solid foundation in what the clinical process looks like and really how to be able to make it as streamlined as possible. In addition to that, just because I've been someone who's always been very interested in technology, I did sort of work toward getting an AI credential from IBM, and that's really kind of given me the opportunity to explore lots of different AI tools and be able to share some of that knowledge and insight with you all. So some quick financial disclosures. I am the executive director at Women in Voice, which is a community for women who work in everything related to voice and voice technology, which includes speech language pathologists, linguists, and other speech scientists. I also have a private practice, and during this call, I will be going over some of the tools that I used and have used. However, there will not be any sales or promotion of any of those tools. I'm not going to be selling any programs or products or services. Really, this is an opportunity to be able to share information about how you can utilize some of these tools in your daily practice. So let's start with some definitions just to kind of give us a little bit more of insight into what we're going to talk about later. So the first one is data science. And so in order to really understand the role that AI can play in our clinical practice, it's really important to understand that the foundation is data. And so data science is really a field that deals with the use of data and the application of data to better understand things about the world around us. And so it's really the process of being able to gain knowledge and insights from data, whatever that data is. And so artificial intelligence specifically is the process or it's technology that really seeks to teach computers how to be more human, but always require human input in the form of data. And so then these AI tools are really tools that are developed that help computers and other machines process data in a way that's similar to humans and really removes the need for some of the things that we maybe don't need to do because we can delegate it to these tools or these machines. So now I want to talk about the clinical process, which is really the process of collecting, analyzing, and interpreting data to be able to make decisions about diagnosis, to be able to make decisions about treatment, and to be able to identify when a patient can be discharged. And so really the common thread with all these concepts that we're going to talk about comes down to data. And so that's one of the things that I want you to really keep in mind as we continue to talk about how you then use some of these tools when you think about the data that you're collecting as a clinician. So some basic information about AI, there's that definition there. So it's really about what AI, what computers can do to simulate human intelligence. And it's actually been around for a really long time. And I know ChatGPT is kind of the thing that really caused this explosion where not everyone's talking about AI, but there, in some way, shape, or form, there have been people in the computer science field and the data science field trying to find ways to help computers learn how to do some of the things that humans do to be able to reduce the amount of workload that humans are responsible for taking on. And that's especially true for things that are, a little bit more repetitive, things that don't always require much of a variation or a shift in terms of what you're presenting or what you're producing. So now some of the components of AI are, and I'm going to talk really briefly about these, but not go too much into depth into it. Like we've got neural networks, computer vision, natural language processing, machine learning, and deep learning. And the basic thing to keep in mind about these components is that neural networks and computer vision are really designed to teach computers based on the way that the human brain learns. And so neural networks are actually designed with the actual networks of the brain in mind. So they function in a similar way that the networks of the brain function. Computer vision is really about enabling computers to be able to process data from images and then be able to recognize what those images are based on that data. Natural language processing deals with having computers be able to understand words, not necessarily what they mean, but be able to recognize words based on, again, the data that they're receiving. And so machine learning and deep learning are actually processes by which computers then pick up this data and process it and interpret it and then be able to produce a response. So for example, I think many of you have probably used ChatGPT in some way, shape, or form. One of the ways that ChatGPT is able to function is because it's been trained on all of this data from all of these different sources. And so when you ask a question, it's not that it's actually responding to you because it understands your question. It's just been able to match the words in your question with the answer that it's been trained on. And so when it recognizes the words in your question, it just provides you with the answers that it's been trained on. And that's one of the reasons why it really is an evolving process, because the sources of data are really the most important pieces of what goes into making sure a model is accurate and actually provides answers that are relevant and useful. So I'm going to talk also about the functions of AI. And that's really, again, keeping in mind some of the things that I've described, which is about being able to process data in a way that's similar to the way humans process data, and then to be able to produce a response, again, in a way that's similar to how humans produce a response. And so one of the ways that AI is able to do that is through perception. And so getting inputs of data and then being able to be trained on that data, getting enough of that data over a period of time to be able to then start to recognize specific pieces of that data and then assign it with some type of association or some type of classification. And then being able to recognize different types of patterns in the data, being able to make predictions about the data. And then based on that foundation, being able to solve problems and then, not make decisions the way that a human would make decisions, but being able to sort of identify common trends in the data that allows it to identify what an appropriate decision might be based on, again, the data that's being presented. So because there are so many variables when it comes to developing these AI tools, there are lots of ethical considerations in using them. And so these are called the 5 pillars of AI ethics. And they tend to mostly apply to developers and AI officers and other people who are actually developing the technology. But one of the things that I think is really important to keep in mind is that as consumers, it's really important for us to be using tools that are developed with an understanding of what these ethical considerations are. So for instance, the pillar of transparency really has to do with a model that is explainable. And so something that you as a layperson can understand where they got the data from and how they sort of arrived at some of the conclusions that they arrived at without there being a breakdown in your understanding. And then the pillar of fairness, which really relates to being able to understand and make sure that there are no biases, whether cultural or otherwise, in how the data was collected, into what sources of data are being used. And then, of course, privacy, which is making sure that there is consent in the use of the data that's being trained, the models being trained on, but then also recognizing that if you as a clinician are wanting to explore the use of AI tools, you're making sure that you're doing so with the consent of whatever client or patient that you're working with, because that not only helps to protect their privacy, but it also helps to ensure that really in everything that you're doing, you are prioritizing their well-being and what is most beneficial for them. And then the last two pillars that have to do with accountability and sustainability, again, are more closely related to the people who are actually developing the tool, because it's just making sure that they are still responsible for whatever it is that their tool, whatever their tool does essentially, and really being able to step in and make corrections as necessary if someone's use of their tool were to cause some type of harm to others. And then sustainability really just deals with making sure that the developers of these tools are doing so with a mind to understand how it might impact society, how it might impact individuals, and really trying to make sure that any tool that's being developed or used is used for the betterment of society as a whole, and not just for someone's sort of own personal purposes, excuse me. And so again, these are really important things to keep in mind, and certainly we'll be able to talk more about what that looks like within the context of speech language pathology. But for now, here are just some of the things to keep in mind about the way that the sort of the AI world itself is set up, and more importantly, the way that it's still evolving. So when I talk about the clinical process, regardless of what setting you're in, there really is this progression where you start with the intake. And what you're doing at that point is you're really trying to gather information about the concern with the client. And so you are identifying what your sources of data will be, and whether that's a parent or caregiver, a teacher, someone else who is sort of present in the client's life, maybe a primary care provider or maybe any other specialist, and you're really gathering that data and organizing the data to be able to understand what the areas of need are. And so that leads into the evaluation, which is really the opportunity to apply that clinical knowledge of what the norms are, or what should be expected, or what areas of functioning you are sort of identifying as needing to probe further into. And then during the evaluation, you're collecting data on how the client is functioning, what the client's strengths are, what the client's needs are. And then that really helps to feed into treatment planning, where you are then designing a treatment plan that addresses those areas for intervention. And then you're providing that treatment, and then you're modifying it, you're making accommodations based on how the client responds to that treatment. And then you start to identify the point at which that client no longer needs that intervention, or maybe needs a little bit of a reduction in however much scaffolding you're providing, or they possibly need any additional supports that are outside of your scope, and so on. And so again, this is going to look different in the school setting. This is going to look different in private practice. It's going to look different in early intervention, home health, in a skilled nursing facility. But the clinical process really has these specific target points, and every single one of those target points require a collection of data, analysis of data, and a decision-making process that's based on data. And so that's really what I want to be able to highlight today, as how you can think through not only this clinical process, but then look at these clinical tasks that are embedded within the process, and then identify how you can use some of the tools that are available to just make your life a little bit easier, and certainly be able to provide you with just much more support for the tasks that you have to complete on behalf of your clients. And so if you're a clinician, no matter what setting you're in, you are conducting observations, you're interviewing caregivers, you're interviewing teachers, you're interviewing other health professionals, anyone who can provide you with data about how the client is functioning and what the client's needs may be. You're providing counseling and rapport building because you've got to establish that relationship with your client and their caregivers to be able to really have the opportunity to understand what their needs are, and then to be able to certainly build that bridge of trust that enables them to receive the care that you want to provide. And then from a sort of more direct clinical perspective, you are completing diagnoses, you are providing treatment, and you're collecting data. And you want to make sure that, when you're going through the diagnostic process, you have tools that enable you to identify what is going on, what may be going on, and to be able to rule out what is likely not going on. And in terms of treatment, you want to be able to identify the sort of evidence-based approaches that will enable you to see the progress that you want to see in your client. And then, of course, you're completing documentation because you want to be able to justify your treatment approaches. You want to be able to share information with all the people in the client's life so that they know how they can support them and encourage carryover. And you want to be able to provide that education either to the client if they are old enough to receive it and understand it, and to parent or caregiver or other stakeholders who engage with the client so that you're really getting this well-rounded network of intervention that goes beyond what you're doing in your sessions with the client. So when we talk about those tools, right, so we're really saying there are tools available for data collection. There are tools available for data analysis. There are tools available for supporting diagnostic impressions, for documentation, and for client or caregiver education. We're going to go over some of those tools today, and then you're going to get a chance to practice on your own. And the goal for that is to be able to, again, help you to not only learn about some of the tools that I use or have used, but also to be able to really go through this process of thinking about how you might use these tools. And that's one of the things that I really want to kind of make sure that you're able to take away from this call, which is that anything that you use that's related to AI is always a tool that you can use in whatever best serves your purposes. And so it's really important to first start from that place of understanding what it is that you want to use the tool for, and then really going from that place of understanding to using it in a way that, again, best serves your purposes. So we're going to start with ChatGPT because that is one of the more popular ones. And so in order to really put this in the best context, I'm going to give you a scenario. And so that scenario is you have a 2-year-old who was referred to you. And the concern was that the 2-year-old is not yet using words. And parents are concerned that she might receive a diagnosis of autistic disorder. And so in thinking about the clinical process, you really want to be able to collect data on the parents' concerns. And you might want to also collect data on what new research is out there about developmental norms or milestones. You might also want to collect data on other sort of sources of the resources that might be available for parents who are really need sort of that type of guidance or might benefit from learning a little bit more about the way that development works to be able to sort of better understand how their child is developing. So this is a video that has some of those uses embedded, not all of them, but then that's just another example of how really what you want to think about your purpose first, and then you want to be able to use the tool to be able to serve that purpose. And so the first question that I asked ChatGPT was about developmental norms. And you can see right there that it gives you an answer, but it's a very, very general answer. And so that's just a reminder that you are the clinician, you are the tool for developing a clinical plan, you are the tool for delivering treatment that's appropriate, but these are resources that can help you uh, identify the direction that you want to go in, and then also the best way to approach the actual problem that you're trying to solve within your clinical practice. And so if I were to look at this response, I would get, and let's say I didn't have a lot of knowledge about what 2-year-olds should be doing. I might ask a follow-up question specifically about the milestones for language and communication. And then depending on how you actually craft your question, you might get a little bit more information, you might get the same information, but really what you're doing is you're identifying a starting point where you're saying, okay, as a clinician, I really want to be able to better understand how this child is developing, and this is really not an area that I have had much experience or had much of sort of an understanding. And so let me ask ChatGPT. And then the cool thing about it is that it remembers your conversations. And so you could have an entire back and forth conversation with this tool where what it would do would be to reach into its data sources and provide you with responses that are out there that are readily available without you having to go to each individual data source. And of course, this is where you're really using your clinical judgment to identify what those sources are and kind of making sure that those sources are actually accurate so that the information that you're getting from it, you're not sort of treating it as the kind of the sort of the ultimate source of information. So another question that I asked is right down there, which was, what are some examples of goals that I could write? And so you can see that I made that very specific because in this fictional scenario, I'm imagining that I had this interview with this little girl's parents, and they said, well, our main concern is that she's not yet using words to ask for what she wants. And so making the prompt much more specific means that I'm more likely to get a more specific or relevant answer than if I had just said, oh, what are some examples of goals I could write for language? So I'm just going to let it play starting from the top just so you can see the progression. And so you can see these are some goals that again, I wouldn't go in and just copy and paste these goals, but this would be a really good starting point to sort of identify some more specific targets that are relevant to the client and also reflect the client's parents' priorities. And so here's another question I asked in thinking about, well, if I want to come up with a particular treatment approach, what is the evidence base behind the use of AAC devices to support communication? And so you can think about how this would be beneficial, not just for yourself as a clinician, but also something that you can share with caregivers or other professionals who might be a little bit hesitant about incorporating AAC into a treatment plan. And so this is, again, you can see I've asked that question about a summary, and now I'm asking a more specific question about journal articles that support the use of AAC devices in speech therapy. And then ask another question, because I looked at the years that those articles were published. And so this is going back to that reminder that this is and always will be a tool for your use. And you, as the clinician, have the opportunity to really evaluate the content that it's providing you with. And then, based on understanding what it is that you are actually trying to get in terms of answers, you can continue to clarify and specify until you get the resources that you are looking for. And then you're in a much better position to sort of embed that into what you do on a regular basis. So now we can go on to the next tool, and this is actually two parts. And so the first thing I'm going to have us do is to just listen to audio of a treatment session, and then an AI transcription service that really helps with documenting the session. And so I do want to kind of clarify. So this is something that I got off of YouTube. And so there's no there are no privacy concerns, and also it unfortunately is not a speech therapy session. It is an occupational therapy session. However, the goal is really less about the content, but really about being able to see how the tool itself works. And so I'm going to hit play. And so I just would encourage you to just listen. And then if you'd like to take notes, just to be able to see, sort of compare your notes with what the AI tool is going to do.
So at our last session during lunchtime, you and Charlie practiced having himself on the chair and feeding himself, and how did that go for you guys?
It was good. He seemed to enjoy it then. He hasn't enjoyed it since.
Oh, okay.
But it was a good thing for me to do, to learn how to get him messy, for me to be okay with it, and I think it was, good for him to explore the food on his hands and in his mouth.
So what was different than when you thought that he enjoyed it when we were together versus sort of this?
I've been putting the food in front of him, and he just kind of stares at it, and I'll take his hand and put it in it, and he doesn't know what to do.
Okay.
And then I stick his finger in his mouth, and he'll suck on his finger, but then he won't go back for it himself. It's all me kind of me making him do it.
Okay.
But he does like to grab the spoon, and he's kind of gotten angry with me when I try to hold the spoon. So he wants to do that himself. So that's been interesting, but he's still not that interested in getting messy.
Okay.
And it might be partly from my apprehension of him getting messy.
Okay, so when we were doing it though, you were really engaged and very excited. Did you feel like you carried that through?
No. when you were here, it was like I was still kind of like I don't know, I was being nervous about him.
Yeah.
So I need to work on that myself.
Okay.
And then he'll probably be better with it.
So maybe the next couple of days will sort of help be more relaxed in the feeding fun and the messiness.
Yeah.
I know.
And I think also I was giving him the spoon first and then trying to get him into it. So I probably need to not even show him the spoon.
Right.
Put the food on the table and let him start that way.
So that's good insight that he was sort of gravitating towards something he felt safe with and liked to do versus kind of initially going into the feeding part. Okay. Are you his only feeder, or does his dad feed him?
It's pretty much me. Okay. My husband will give him a bottle, but I'm usually the one feeding him.
And how does your husband feel about getting messy?
He doesn't like it. It's kind of
Okay,
fun
so Charlie has it. You do. I know. Okay, well, you just identified a couple things that you're going to practice throughout this week, and I think I'll check in with you maybe in an email. We'll see how that goes a little bit differently by not giving him the spoon first and starting with just the foods. Okay. I know. And how about dry foods versus wet foods? Do you notice a difference with that?
He's still kind of looking to me when he has puffs in his hand.
Okay.
Because he's not able to do the pincer grip and just kind of, brings his fist to his hand and then gets frustrated. So he's still kind of like looking at me and then waits and then.
Okay, so but he's made that connection between it's going to my mouth, but my mom's going to help me. Yeah. Instead of just giving it to you like he was doing before. Right. So we made a little step of progress there. Okay, that's good. What other ways have you been able to help him use his fingers individually? Have you found anything else in play that sticks out for you?
He's flipping pages of books, but I guess that's more his hand. Okay.
Any pointing or poking into things? Okay, well, let's think about some of those things today. We'll look at some of that stuff as well. Okay, the other thing that we wanted to touch on from the last 2 sessions that we had is helping him pull to stand while he's playing so that he's not just pulling to stand on you, but he has more freedom for moving around. Right. How's that going for you?
He's doing better with the table. He's still kind of waiting for me to give him the initial boost, and so I'm trying not to pull up as much. I'm trying to let him do most of the work. I did bring up this ottoman, and he seems really comfortable with that. And if I put, a dog toy or a ball on it, he's really excited to stand up on that, actually more so than the table. Okay. I don't know if it's maybe the height difference or that it's soft, but he likes that.
So you found more ways, though, to kind of give him that encouragement to do it on his own.
And yesterday he was going from being on the ottoman and he was moving over to the chair. And I held the chair and I let him do it. Oh, good. But he was seemed excited to be kind of cruising. But it was really slow, but he was slowly moving around.
Very interesting. All right, we've made some progress in that area. Okay, so what would you like to focus on today? Diaper changing, you mentioned.
For some reason, the last couple of days, it's gotten better.
Well, hey, there you go.
And I think I decided to put him back up on the table because he was too easy for him to crawl away on the floor. Okay. And I think almost it was like an impetus for him to crawl. Okay. So I put him back on the table and I kind of just held him and I was, as soon as he started to turn, I would hold his shoulder, hold his hip. And for the moment, he's being good about it.
All right, so you found something that worked for you. So we tried, some people put it on the floor, but if that's more of I'm going to get going kind of thing, back on the table, it works fine.
All right, and I did see that some people had some issues with the audio. I apologize for that, and no worries, because really what I am most excited about is the tool itself. And so the reason why I had to sort of listen to the audio was to be able to compare and contrast with how the tool sort of analyzed the audio and what it produced in terms of documentation. So I'm going to go ahead and play this video, which you'll be able to kind of see then what this particular tool was able to collect from the audio and then create in terms of documentation. And so you can see that it's organized into a sort of classic SOAP note format. And then you can see where there are options to give feedback on whether or not that their transcription and analysis was, accurate. And of course, again, because this is something that's sort of used generally for medical transcription, it doesn't know that this is a this is a client that probably wouldn't need vital signs, but you can kind of see it also has this overview of a plan and action item. And then toward the end of the video, it also has a section where it summarizes the session and talks about some of the strategies that the parent can use and allows you to send a message securely with that content to the parent or caregiver. And so one of the things that I do want to stress in going over this is that this is not specific to this particular tool or this particular product. This is something that AI can do. And really, there are so many opportunities for us as clinicians to be able to not necessarily think just in terms of what ChatGPT can do, but really think about what AI can do and then how we can incorporate all of its functions into the things that we do on a daily basis. And so next up, this is a sort of data analysis tool that I'm going to give a little bit of an overview about before I hit play on the video. And so one of the things that I know can be a really significant pain point for clinicians is taking data and being able to make sure that you're taking enough data during a session, making sure that you are taking enough relevant data during a session, and then being able to really use that data and to be able to gain insights from the data so that not only are you able to sort of make changes to your practice as needed, but you're also able to sort of engage with other people who may not really understand what you're doing or what you're taking data on or why it matters and so on. And so I've, again, taken this fictional 2-year-old girl, I named her Anna. And so what I did was to essentially create a data source for single words and her use of single words over a 30-day period. And the purpose of doing that was really to be able to showcase how this particular tool can help to organize the data that you collect and then also provide visualizations so that it's a lot easier to track, but then also a lot easier to be able to share with someone who doesn't really, kind of understand what you're tracking or maybe might benefit from additional help in understanding the value of tracking that particular thing. And so I'm going to go ahead and play the video so that you can get a sense of how this tool works in that context. So you can see this is just, again, this is very fictional. So it would be nice if we had, within 30 days, the 20 words within 30 days. But there you have it. And then what I did was create a dashboard that shows all the words in that 30-day period. And then it kind of gives me the option to sort it by all those different options or to sort the visualization by all those other options. And so you can see, we started with, no words by June 1st, and then by June 26th, we had 20 words. And then it's a lot easier to be able to see that. You can see where you can put your data sources and where you can, really diversify those sources to be able to, again, specify, well, if I want to be able to gain insights from or get information about this particular thing that I'm tracking, this is how I'm collecting the data. This is how I'm organizing the data. And then I'm using this tool to be able to help me make decisions about the data, help me communicate about the data to people who might sort of need that insight that I have. And so that takes away a significant amount of the burden of having to do this manually, and also makes it a lot easier to be able to really explain to other people the value of the work that we're doing, which is important because I know that it's not always very clear to people who are not in the field the value that we bring to the lives of the clients that we work with. So,
Deborah, there are a couple of questions about this tool. Which tool is this?
So this is called Zoho Analytics.
Thank you.
But again, the tool itself is not as important as what it can do. And so there are other analytics dashboards that do the same thing or something similar. And really, it's about being able to really go through and identify the tool that works best for you. So, important things to keep in mind. AI is a tool. It is always a tool, and it's for supporting your purpose as a clinician. And so what that means is that you can really use it in any way that sort of makes the most sense for you and benefits the client in order to suit your purposes as a clinician. And so it's not going to take your job, it's not going to do it for you, but it's always going to enhance your ability to do your job, even better. And because it always relies on the data it receives, like you are always the person that's going to be driving whatever it is that this tool is used for. And so again, these important considerations, it's not a substitute for human intelligence, creativity, or ability. And I think that it's something that provides significant opportunities for SLPs in every setting to be able to simplify the work that they do and just make sure that they are in that position to provide the best quality of care to their clients. And I think most importantly, the use of AI is still evolving. And so what that means is as SLPs, as clinicians, we can be part of the process of making sure that it is really being used used in ways that support clients' needs, and that we can, with our understanding of how it works, be able to contribute to the conversation about how these models are being built and used at a larger scale. So here are my references, and again, because it's still very much an evolving field, there are new things coming out every single day, and it's not always practical to stay on top of what new research or what new information is out there. But certainly, one of the things I would encourage everyone to do is to really start to explore all the ways that you can use these tools, and just really be able to start a conversation about other uses that I may not have covered today, and really keeping that focus on that purpose that we want to achieve on behalf of our clients, and everything that is possible given the fact that these models are being developed to mirror human learning, human decision making, human information processing. So now I will give some time for a Q&A. I know that we're not going to have enough time to go through all of the questions, but I've put my email address there if you would like to reach out to me personally. And then we will be doing follow-ups after this, and the goal is really to give you a foundation today. I will also be sharing some homework where you will have a chance to practice using some of these tools on your own, and really have the opportunity to come up with questions that might help you better understand, get answers that might help you better understand how you can use this in your practice, and to just make your work a little bit easier, and certainly serve your clients a little better. All right, so I see some questions in the Q&A, and so I'm just going to kind of start from the first question and work my way down. And so there are no tools in particular that I recommend, just because as a clinician, you really are in the driver's seat, and you can explore a tool and then determine if it's something that really best serves your purposes, whatever those purposes are. But what I can do is certainly kind of share tools that I have used and that I found to be really helpful, like from that process. And so, for instance, when it comes to the intakes and evaluations, like just specifically for report writing, what I actually tend to do, because it's part of my process, is I record both. So I have an intake form and take, it's pretty in-depth, and I take information from that intake form and kind of have questions, come up with questions that I have for the client or the client's caregiver. And then what I actually do is I record the intake meeting and any follow-ups in terms of evaluations. And yes, that happens with the client or caregiver's consent. And then what I do is I just run that recording through an AI tool that I use, which will summarize, identify sort of patterns and whatever kind of else that I essentially ask it to do. And then from that, I just kind of go through and based on whatever my impressions were, I'll update the report. And so like, regardless of what type of client I'm doing that for, I'm still going from that perspective of saying, I want to have this information from this recording. And so I'm sort of plugging it into this particular tool to get that information. And then I like to have the recordings and not just have everything go through the tool, because I'm usually looking for more things than just the, sort of the summary for report writing, because I also like to kind of go back and say, okay, well, this is the baseline, and this is kind of where we started with this particular intervention. And now it's just a great way for me to kind of go back and compare and contrast in terms of progress. And so someone asked, how reliable is the information that ChatGPT provides? And the answer is it varies. And so that's where, we're not substituting it for sort of human knowledge and insight. We're just kind of using it to augment human knowledge and insight. And so one of the things that I tend to do if I ask a question is I will go and sort of do my own research. So for instance, if we go back to the example where I asked about developmental milestones, that was a very, very general, very, very brief summary. And I know many more sources for developmental norms that I would go to before I would use that information from ChatGPT. But in a way, that's one of the reasons why we want to keep our mind on the data, because ChatGPT relies on data and data sources. And so if as clinicians, we are part of the source of that data and we sort of are able to provide access to that data to ensure that those who are building the models know that that data is available, then they can include it in their sources of data and make the answers a lot more reliable. So the short answer is, you never want to substitute the knowledge that you have as a clinician with whatever answer you're getting from ChatGPT or any other tool. And I see another question in the Q&A box where, yes, I already answered that, about always remembering that those pillars of AI ethics require privacy of data. And certainly our own code of ethics require for us to ensure that our clients are informed about any of our practices regarding their care. And so we're notifying them and they're providing informed consent. And so kind of going back to this whole process of recognizing that there are so many tools out there, and part of our responsibility in evaluating their use is being able to identify where the data is coming from, how the responses or the answers are being generated, what's being stored, what isn't being stored. And I will say a lot of the tools that I have come across, the companies that develop them are usually pretty good about being transparent about where their sources of data are coming from and how they are arriving at whatever answers or responses that they are getting. And so because it is still an evolving field, there are going to be errors, there are going to be all sorts of things and there are even some cases where some AI tools are making things up. And so it is very much still a growing and evolving field and process, which is why it can never be and should never be a substitute for everything that you've learned in school, everything that you've learned in your clinical practice. It's always a tool that you can use and that you can monitor and evaluate and make sure that it serves your purposes. And so, so I see a question asking about educational settings or organizations that currently use AI. And I am not, I certainly know lots of organizations that are using AI. I don't know of any educational ones. And I do know that it's certainly part of a conversation that a lot of people are having about how they would incorporate AI into education. I know one of the things that Google is doing is providing, training and access for teachers to be able to facilitate that. And so I see a question asking about a tool that integrates with an EHR. And yes, again, there are tools that would integrate with an EHR and not, will sort of remove the need for copy and paste. A lot of those tools are paid and require you to sign up for a demo and do all sorts of types of things. So that's really something that, in your independent research, you have an opportunity to explore and determine, sort of which tool would be the best fit for you and for your purposes, and really being able to understand that all of these tools provide an opportunity to not only get this this process be more streamlined or have this process be more streamlined, but it also provides you with the opportunity to think about other ways that AI could be used. And I think that's one of the ways that, again, as clinicians, we can really have a hand in transforming our field and sort of being able to ensure that some of these things are being sort of supported in our workplaces, and certainly for the purposes of making some of the sort of the challenges that we encounter in all of these different settings be a little bit less of a burden, because these tools are part of our workflows. I think it's certainly one of the great ways that we can get started, and also, for anyone who is interested, I definitely recommend going a little bit deeper and kind of learning how to, like, sort of how AI itself works, and just being able to have a little bit more of that foundation to think through, well, I know that this is the process by which this model takes this information and then essentially comes up with a response or comes up with an output. And so because I have a better understanding of this, I have a better understanding of how it integrates into my workflow, and I'm just in a better position to advocate for my employer, or I'm in a better position to educate others, and really, again, helps to take you from that place of, thinking about AI as just being ChatGPT, but really recognizing that it can be anything that you want it to be, depending on what you want to use it for and what you know of what it can do for you. And so I do see some other questions that are not in the Q&A. I unfortunately will not be able to get to all of them just because of time, but again, I do, my email is right there. And so please feel free to send me a message if you have any questions that I did not answer. And I think it'll be a great opportunity to continue the conversation, because this is something that we have an opportunity, again, to contribute to and to really help to make our field, that much better. And so going through the messages here, actually, I see someone had asked about cost. Yes, there are some tools that are free. There's some tools that have a free trial. There's some tools that are paid. what I actually started doing was to so a couple of years ago, I had taken some programming courses, and so I actually started to build my own tools because that way, not really having to go through some of the paywalls that you encounter when you're trying to go through and find a tool that really works for you, but then it also gives you the opportunity to customize your tools for your own purposes. And so, again, if this is something that you are inclined to do, I would recommend doing it because it gives you that much more freedom to be able to develop tools that work exactly for what you want them to work for. So I see some questions about Zoho Analytics in particular, asking if it's HIPAA compliant. I guess so. All of the tools that I presented, with the exception of ChatGPT, are HIPAA compliant. And so if you were going to sign up with any of those organizations, it would just mean having to sign what's called a business associate agreement, which is what allows them to give the data that you would be processing through those channels, the level of privacy that it needs to comply with HIPAA and other privacy laws. And so that's something to keep in mind, especially as you're evaluating other tools that I didn't cover, which allows you to make sure, well, is this something that is HIPAA compliant? Is this something that serves my purposes? Is this something that, not only I, but other professionals, other providers that I work with can use and access? Because that all means that you're not only going to be able to use it to serve all of your specific purposes, but you'll be able to sort of expand the way that it's being used and make sure that it's something that gets broadly adopted within your organization or setting. And so I do have a consent form. I'm happy to send that as a template to anyone who would be interested in receiving one. And again, this is very, very sort of foundational. There's the opportunity to continue the conversation. You can send me an email if you have any questions. And I really appreciate your time today and the opportunity to share some of this with you, and very much looking forward to the opportunity to connect with as many of you as would be interested in continuing the conversation over email, and just kind of working together to bring AI into our field. Thank you all so much.
Deborah, thank you so much. Excuse me. Thank you so much for your presentation and sharing your expertise on this relatively new topic. For those of you who are here, if you have additional questions, please keep in mind that we do have another session next week, and we will also be scheduling a Q&A session in August. That Q&A session will likely not offer ASHA CEUs, but if you do have questions, you just want to learn more about AI and how you can use that in your practice or your school, we will have that session coming up. Just as a reminder, for anybody who has not completed the assessment and is looking for ASHA CEUs, I've added that link in the chat. Also, once the webinar ends, you should be redirected to a post-session page with a link to the survey and the assessment. The survey is optional. The assessment is required, however, if you would like to earn ASHA CEUs. So please be sure to complete that assessment if you would like ASHA CEUs. Thank you everyone for attending and have a great day.